Thousands of mental health patients readmitted within a month in England. We're going to read into this more from The Guardian, you guys. Let's go. Good morning, good afternoon, good evening, wherever you are in the world. This is REGANELITE here with an article from The Guardian with the headline that thousands of mental health patients are readmitted within a month in England. Experts says being discharged can prematurely be disastrous, setting back chances of a full recovery. I've talked about my mental health issues, guys, and even I'm someone who may look completely fine on the outside. Inside, sometimes you just really don't know what's going on inside, guys, as some of you may know. It's so important that those who are let out, or whatever they're going through, that they truly are okay and they're truly going to be all right. It's so easy for people to assume that they're going to be fine, or there's not going to be any problems, that they're okay. But I also think that what's happening with it in England with regards to cost of living, the health crisis, and the consistent amount of problems that are taking place in the country right now is exacerbating these issues. There's not a sense of hope and optimism from people, and I don't think and I think that's playing a part into it. Whatever the future holds in terms of the political spectrum. But is it a case that they're not being is it a case that the premature checks, are the experts really looking at it in detail, or is it a case of the mental health wards are so full that they're pushing them out early in the hopes that they'll be all right on their own, and then they end up coming back? I think that's kind of the issue, because with so many issues, health issues that we have up and down the country right now, with the crisis with the NHS, I think that's the main reason why this might be happening. But I guess the real question is what are we going to do to resolve it? What would Labour do in government to help resolve this with the issue of mental health? Now, I have heard them say that they're going to tackle mental health, but I don't know the details. But one thing's for sure is that when people are struggling with mental health, it can affect their relationships with loved ones, it can affect their relationships with family, it can affect their relationship with their work, and I'm an example of that. It can be very detrimental to people, and it's a real thing, and both men and women need to be able to talk about it. So thousands of patients are being readmitted to NHS mental health units in England every year as soon as being discharged, raising concerns about the poor care, bed shortages, and increased risk of suicide. Experts says being discharged prematurely can be upsetting, setting back the patient's chances of making a full recovery can be disastrous for their health. NHS figures from NHS Mental Health Trust in England show that last year almost 5,000 people, children and adults, were readmitted to a mental health facility within a month of leaving. The Labour MP, Dr. Rosena, Allin-Khan, said the alarming data which she obtained under the Freedom of Information Law shows too many patients were not receiving enough help to recover. So they're saying here that the care is poor, bed shortages. The smallest little these things, guys. They don't make. It just shows that not enough is being done here. The Labour MP, Dr. Rosena Allin-Khan, said the alarming data which she obtained. Oh yeah, sorry, I read that already. In all, 3,381 patients were readmitted within 30 days of their discharge by 35 of the 54 specialist mental trusts in England during 2022-2023. According to the responses Allin-Khan received, exaggerating those figures to all 54 trusts suggested that the estimate 4,927 people were readmitted within a month, she said. That is crazy. Is it even working then? If they're being readmitted within 30 days, if this is true, are they even what are they doing within those walls to ensure that they don't come back within 30 days? Never mind coming back at all. And I think that's a question that needs to be asked. Also in 2022-2023, 1,972 people were readmitted by 36 trusts within a week of discharge, something NHS mental health service should accept should never happen. Within a week as well. That's really bad. Exaggeration of those figures to the 54 care providers showed that an estimated 2,794 people returned as an inpatient within 7 days, according to the MP's research. Khan said with record waiting lists of mental health beds in short supply, it's alarming that many patients are being discharged only to be readmitted within days. Every patient expert receives full and appropriate mental health support, so it's concerning that so many patients are being discharged so prematurely. Being discharged too soon can have a disastrous impact, stunting progress towards full recovery, ultimately causing further damage to the patient's mental health. Figures show that both 7 and 30-day readmissions are declining. Confirmed 7-day readmissions were down from 2,336 in 2017-2018, and confirmed 30-day readmission were down from 4,338 over the same period. But experts said any early returns to hospital after discharge could be highly damaging for patients who remain mentally fragile and could heighten the risk that they kill themselves. Last year, Mersey Care Trust had the highest number of the 30-day readmissions, with 321, followed by East London 298 and Sussex Partnership 278 trusts. The highest number in a 7-day readmission were at Barnet, Enfield and Haringey 191, Lancashire and South Cumbria 185 and East London 159 trusts. Majora Wallace, the chief executive of the mental health charity Sane, said she was shocked by the figure. Too many readmissions occur because vulnerable patients receive inadequate help from the community-based mental health team after their discharge. She said the lack of support can be so significant that in some tragic cases the patients kill themselves. Recent reports of the number of patients who, after discharge, experience unexpected deaths are becoming a cause for concern, Wallace said. The highest risk of suicide can be within the first 48 hours following discharge, yet we still know patients who are left to go home alone to a flat or unsupported accommodation with nowhere to turn for help. To improve the situation, we need time of a mental health worker to escort a patient who had been at risk of visit after discharge. Yet people who contact us this doesn't happen. The team says it takes days to arrive and are sometimes too late, she said. This all ties into when people are not able to recover from their mental health. This ties into a poor workforce and ties into the economy as well, because if the numbers increase and when they get discharged they end up coming back, or God forbid taking their own lives, as we are seeing in some cases, that hurts the economy as well as another innocent life is lost when more should have been done to protect them. Almost 100,000 people a year spend time as an inpatient in mental health, autism and learning disability services in England, NHS figures show. Just over half have been detained under the Mental Health Act. Andy Bell, the chief executive of the Centre for Mental Health think tank, says he welcomes the fact that 7 and 30-day readmissions have declined, but he added it's worrying that so many people are still needing to go back to hospital within 7 days or a month of leaving, while the number are falling. Going back to the hospital so soon after being discharged can be a distressing experience for anyone going through. The NHS stock of mental health beds has fallen dramatically over the last 30 years. That's 30 years, that's not just 14 years. NHS England said Allin-Khan was wrong to exaggerate the figures as she received to all 54 trusts, but he did not explain why readmissions happened or respond directly to the findings. And a spokesperson has said it is misleading to set up data in this way without full responses. NHS mental health teams to work discharge patients at the appropriate time. And under NHS long-term plan, we are increasing funding for mental health service by 2.3 billion a year. This includes nearly 1 billion a year to transform community mental health services, which are supporting people to stay well after discharge. But there are still people coming back after 30 days. There are still people coming back after 7 days, and that's a big issue, guys. That should not be happening in any way, shape, or form. there are obviously understandable. There are cases where people do come back, but to come back that quick, for me, that does raise questions about the way that they are being looked after they are after they are released from mental health units. And I think that's an issue there. Like, what is the plan? Like, what is the plan? Do they have? Am I assuming that they have an action plan of some sort after they are released from the discharge unit, and do they have a clear path of where they're going to go in their lives and what they're going to do? Is there a clear way for them? I think that's a good question. I think sometimes it can be really disheartening, um, as someone who has accepted that they have mental health issues. I accept that I have those troubles, and it has had an effect on me. Um, it's really disheartening to read this, guys. But I think it's really important that we talk about mental health, and perhaps maybe sometime in the new year we will talk about it again on a live stream. Um, it's a very difficult job. I can say that for these workers who have to deal with people with mental health. I can't tell you how difficult it must be for them to go to work with them, to try and help them, recover them, and get them back on their feet, only for them to come back. It is a very difficult job, to say the least, guys. So what do you guys think? What do you guys make of mental health patients readmitted within a month, some within a week? They're saying that the numbers of them readmitting so quickly are going down. However, should it even be happening? What are numbers like maybe in your countries? What more could be done? What ideas, maybe suggestions you guys have? Let me know in the comment section down below. Hit the like button, be greatly appreciated. Share this across social media and hit that bell notification icon so you'll be notified when I upload another video. And if you want to financially support me, you can do so by joining me on YouTube membership for just 99p, or joining me on Patreon for exclusive content. Thanks so much for watching, and I hope to catch you all very, very soon.